Hello, welcome again to class. Thank you so much for staying tuned. I want to appreciate you for liking, for sharing the video. Thank you for subscribing. Thank you for following us on the various social media platforms. I believe you're gaining value, and that's the whole essence of having these things. Now, straight into what we have today. We already started in the previous class with infectious bursal disease, and before this we had infectious bronchitis, IB. This is IBD, different. And the link between the both of them is that they're both infectious, they're viral diseases. Now, we started already by making this known. Infectious bursal disease is generally known as Gumboro. Other names are infectious bursitis because they affect the bursal fibrosis. Now, the other name is infectious avian nephrosis. Now, we looked at it previously, and then we looked at the causal agent to be the binal virus. And one thing we said about viral ailments is that they are not always cured or treated, but you can prevent them. And in cases where they've already come down with animals, what you can do is that you can treat with antibiotics to prevent secondary infection or other ailments that may result from the first suppression by the viral disease. Now, what this is, now in saying this, it brings me back to something very peculiar about Gumboro disease. It is an immunosuppressive disease. It has the capacity to suppress, depress, bring down the immune system of infected animals. And this time the chicks will usually be about 3 weeks old, or just around a little over 3 weeks old. Now, what we have today is the mode of transmission. Now, just again, yesterday we looked at the minimal immunosuppressive and the acute. The minimal, you just have a few signs. You see, like the fluffy feather, you see difficulty in breathing and other things. But then in the acute, you begin to have hemorrhages, internal bleeding, you begin to have lesions and other things that can be other features, signs and symptoms that can be noticed when you carry out a postmortem operation. Now, we have today the mode of transmission, the treatment, and then the prevention, and then we'll wrap up this, and then we'll go to other ailments in the next class. But let's go to this quickly. Now, what's the mode of the transmission? Like most viral diseases, like we looked at infectious bursitis, it's airborne. They're usually airborne, carried by the air. And for example, it's shared by a chick's dropping and is spread in the air and carried in the dust. Now, what do we do in treating those specific treatments? But antibiotics can be given if a secondary ailment is about to come about, or to prevent as not just therapeutic but prophylactic ailment, as a prophylaxis to coming down with other ailments as a result of the reduction or the bringing down, the suppression of the immune system. Now, I'll go back again. It means that infectious bursal disease suppresses, brings down the immune system of the animal, making them susceptible or vulnerable to attack by either virus or fungal disease and others. So the treatment with antibiotics will be to take care of whatsoever comes up as a result of the suppression that have been caused by the binal disease, infectious bursal disease. So you'll be treating them but taking care of the virus, it's not always easy, at least for now. As at the time of recording of this video, we don't really have a clear-cut treatment for it. Now, so there have been claims that they are healed, they are cured, but it's not well established for now. So the best is to do the next, prevention. Prevention is usually, now, one thing about prevention is this: key in the beginning is vaccination. Vaccination is number one. But then, proper disposition. I'll come back to biosecurity measures. Now, vaccination of breeder hen, especially those in the hatcheries. You vaccinate the breeder hen with Gumboro pest. It's a particular variant of the vaccine, and Gumboro lifter, and also Beagle pest. Now, when it comes to the broiler chicks are vaccinated with a variant of Gumboro Gumboro City or about 70%. For replacement pullets, that is the pullet, the young of the layer chicken, that is the egg type chicken, we have the killed virus. Now let me say this. For these ones, you have attenuated virus. The vaccine contains attenuated virus. In this case, you have killed virus. Now, I want you to go back to previous videos, the earlier videos. We looked at vaccines, their constituents. Some consist of killed virus, attenuated virus, and even live virus. We talked about vaccines extensively, so you want to go back to the previous video. Then, as we continue the prevention for layers, we use a vaccine that's made up of killed virus. Now, one of the reasons why we use it is to prevent hemorrhage, that is internal bleedings of the thigh of the leg and the proventriculus, and also the prevention of inflammation of the bursal fibers. Then another thing apart from vaccination is, let me even talk about biosecurity. Biosecurity is very key in animal production. Please, by all means, do not allow straying birds or straying birds into your flock. Birds flying, they will pick up viruses or pick up pathogens from different places and get mixed up. No. Don't say someone else's animal have strayed into your place, so that's addition or non-addition. Keep them aside. If someone gives you an animal, a chick, or maybe an adult chicken as a gift, don't introduce into your flock immediately. Keep them at least 2 weeks somewhere in quarantine to see if they have any pathogen in them, or any they are infected already. It will manifest within 2 weeks space, minimum 2 weeks. If they are free of any disease, then you can decide if you like to bring them into your flock. Not every gift is just taken. Now, when people come in, be careful of bags where people bring in, vehicles, and then the clothes people wear. People especially buyers, going from farm to buy things, bringing crates for buying eggs or bags or feed sack or other things. But watchful, be careful. Let there be demarcation. People don't stray into your farm, including relation to, however, a relation who goes into another farm. Please, we love our relationship, but then this is business. We have to draw the line. So please don't come in. But if the person has not visited any farm, the person, if you like, can come into your farm. If you like. Then another thing is proper disposing of dead birds. When birds die, please incinerate them, or you bury them. Dig the hole deep and put them in. Don't just throw things away. Now I want to tell farmers this. Be watchful and try to be present. Some of your farm hands, your staff, they want money. They say they're looking for work, which is good. But really, farm work is not easy. It's actually stressful. It requires people who are dedicated, who will take the job as their own. Sometimes just digging the ground and then burying the birds may be difficult. They just take it, throw it into a bush over there close by, and those things are not good. Those things may still, when those things get swollen and then burst, you just see some spores of some of these things spreading. Now please be careful, biosecurity measure to prevent every form of pathogen. Be careful, be watchful, wash, have foot deep at the entrance of your farm. Wash properly, have a dedicated cloth or overall or whatever it is you use to go in when you're coming out. You can cover your hair. Please, let's obey rules. I want to thank you for staying tuned, for watching up to this time. Thank you so much. Let's do it again in the next class. Thank you so much. See you.